Welcome back. Dr. Jenny Wiggins is a very busy OBGYN at Shannon Medical Center, here now to talk about something that I think is on a lot of people's minds these days. We've talked about vaccinations for coronavirus. You obviously deal with new mothers and women who are trying to get pregnant. Tell us about what you're hearing about some of their fears and concerns.
I think we're seeing a lot of vaccine hesitancy with women who are trying to get pregnant or are currently pregnant just because the vaccine is so new and we don't have long-term data on it at this time. However, our governing bodies, the American College of Obstetrics and Gynecology, along with the Society for Maternal Fetal Medicine and the Society for Reproductive Medicine, have all said that the vaccine is safe for women who are trying to get pregnant. There's no evidence that it decreases male or female fertility, and that it is absolutely recommended for pregnancy, as pregnant mothers are in the high-risk category for having severe complications from COVID.
Is there anywhere in that 9-month period where it's not safe for it, or is it at any time?
It appears to be safe at any time. There's been about 5,100 women at this time through the Pfizer trial whose pregnancies have been followed, who've received the vaccine at all portions during the pregnancy, and women who were originally in a clinical trial who became pregnant during the clinical trial, and those pregnancies have been followed, and there's been no adverse outcomes of the pregnancy with high blood pressure disorders, diabetes, preterm delivery, or spontaneous miscarriage, as opposed to the general population.
What kind of conversations are you having with your patients?
You know, we just talk about, I do a lot of kind of laid back, real talk with my patients. So I just say, what are your concerns? What are you hearing? A lot of them just, messenger RNA sounds scary. Lay people probably haven't heard of that before.
Which are the Pfizer and Moderna vaccines.
Right. And so we just talk about kind of, a little loose about how it works, how long the research has been going on, sort of, we can nerd out a little bit on the mechanism of action if they want to, and just reassure people that there's a lot of safety nets in place with the FDA. And just because something says it is for emergency approval doesn't mean that it's not safe. It's really a numbers game as far as just terminology through the FDA.
You do have to explain that. Obviously, it did have emergency approval from the FDA,
right.
More than a year ago.
And I'm impressed with how, educated and people are trying to be right now, and everybody wants to make the best decision for them and their baby and their family and their future fertility, and we get that. And we just want, at the end of the day, we just don't want our patients to become ill and have complications from something that hopefully we can at least prevent or minimize through being immunized.
The question is, if someone just has a question or wants to just talk to somebody about it, what is the easiest thing to do? Because sometimes you can be afraid of not even know who to talk to or who to ask questions of.
Most of us in the medical field, especially physicians, we are familiar with this technology and what messenger RNA is. Most of us are very happy to answer any questions. They can call and discuss. Our nurses, at least in my office, have been educated kind of about answering some basic questions, and then they're welcome to bring it up during their visits. We bring it up during their annual exams. We bring it up during routine OB visits, and we just kind of I just ask, have you had it? What are you concerned about it? And we can just kind of start a dialogue about that.
All right, Dr. Jenny Wiggins with Shannon Medical Center. Nice to see you.
You too.
Thank you.